This short thought video is to help you understand how including the Cogtrium Telehealth platform in the treatment of autism can enhance the process and improve outcomes and increase efficiency between providers and patients. One of the first things that is important to understand is that autism is not just one thing. As the DSM-5 has made perfectly clear, it is a spectrum of similarly related disorders and conditions that affect patients in often similar ways with often similar treatments. One of the first issues is the people that are actually treating autism. There's a wide variety. They come with different credentials. We have MDs and PhDs, master level therapists, bachelor level therapists, and others. We also have a wide variety of specialties and services that are often employed in the treatment of autism. These can include OTs, SLPs, psychologists, LCSWs, and others. In addition, in the treatment of autism, there are others that play very significant roles. For example, parents and caregivers play a very large role in the treatment of autism and in the improvement of the lives of these people. The other group that is often employed is teachers. Teachers have an inordinate impact on the treatment of autism. When we think of the process, if you think of the general way that a treatment plan may be created, initially there is some sort of assessment, followed by diagnoses. A treatment plan is developed around the special conditions involved with the patients. The treatments are then executed as part of the treatment plan. There's always evaluation of the outcomes, adjustments to the treatment plan, and then it continues on. At different levels and in different places, telehealth can play and does play a major role. If you think of the beginning of assessment, often assessments are a way of screening out because of the awareness so many parents have of autism. There's always worry. Is my child normal? Are they progressing adequately? Are there special considerations? Screenings are a common way of sorting through who needs further assessment and diagnosis. Good example is the MCHAT. MCHATs are, pediatricians are told that they should be doing the MCHAT at 18-month and 24-month well baby visits. It's a simple test, easily done, and here is a prime example of where telehealth can make huge sense. So many organizations, including Cogtrium, offer the MCHAT as a free online service. The difference here with Cogtrium Telehealth is that the follow-up examination and evaluation of that can be done by telehealth with the parents to express what the understandings are, to identify what the results of the screening are, and on whether there should be further steps to be taken. All of the assessments can be thought of in this same sort of way. It's a way of outreaching to people that would not otherwise be able to show up into the physician's office, or that may have concerns that can be alleviated through telehealth with a properly trained provider. The diagnosis is its own set of requirements, not just because of the clinical requirements of a diagnosis, but diagnosis impacts so many things of a child. Often in schools, people with a diagnosis on the autism spectrum receive special benefits. School districts under the federal regulations receive reimbursement. Medicaid covers some and many of these sorts of things. Private insurance can. So it's not just diagnosis in the same sense of, are we establishing a treatment plan for this person and we are saying what are the things that we can address. It's a matter of also meeting these legal requirements and these other items that trigger benefits. So diagnosis becomes its own important piece. If you stop and you think through how diagnosis is achieved, Several methods jump right out. ADOS is a commonly used diagnostic indicator. The ADIR can be helpful from the parent side in understanding. Clinical observation is a major piece of what it is. But these pieces coming together, some of these can be delivered online. Additionally, diagnosis can be live in the realm of certain specialties. Somebody to make that diagnosis is going to be legally binding or binding with a health plan may require a PhD or an MD to be able to deliver it. That can be extremely difficult. Uh, Difficult not in the sense of the diagnosis, but difficult in the sense of arranging the visits and the time necessary to have the evaluation done. This is particularly problematic like with school districts. School districts commonly have 8, 9 month delays between suspicion that an assessment indicates that a diagnosis should be looked at and when it can actually be achieved. That has dramatic impact on a child. That means the resources that are specially available through schools and others may not be there until the diagnosis is actually achieved. It can be part of the individual student's education plan. If you think of how that happens, that means that delays a student's opportunity and access to resources, often a year or more. Think of how we can improve that with telehealth. School districts aren't backlogged because they have adequate personnel. It's because they don't have adequate personnel to handle all of the items. Think of how a team with a behavioral tech at the school district delivering an ADOS with the observation happening remotely with the qualified credentials, the PhD that has the ability to make the diagnosis, observing and participating with their behavioral tech partner in the room with the patient and the parents. It can be a huge efficiency. It's the kind of thing that overcomes the natural inertia that exists in school districts. School districts go on vacation in May and June, beginning May and June. Things can stop until the next school year begins. Think if we had outside resources that could make those diagnoses throughout the summer and be able to deliver those results so that we have those so students can benefit from the benefits they're entitled to. So diagnosis is one of those areas where with creativity, we can dramatically improve the outcome of patients. The other item is the treatment plan itself. There are several areas where treatment can be enhanced by telehealth. One area that is often a weakness in the treatment of autism spectrum disorders is in family counseling and support. We are always focused on the patient, but ultimately the support and the transfer of knowledge has to happen with parents. Think through what the issues are with a parent faced with the diagnosis of autism spectrum disorder for their child. What does it mean? What do I have to do to make my child normal? Will my child ever be normal? What does life look like if we can't make achievements? And I think that outcomes, and I don't mean to speak personally here, but the outcomes can be dramatically different. In some cases, I can point to individuals that are doctors, that are researchers, that have had huge successes in life, that have come through with the diagnosis of autism and the special sorts of treatments that have helped them achieve wildly beyond the success. You can name a number of those kind of people as well. But there's also others that just don't achieve those outcomes. I'm thinking of the 37-year-old man who was diagnosed at 2 and lost the speech and never regained it. Parents were devastated, wanted to have him normal, and normal never came. Speech never came back. He lives in a group home, seems very happy. When you see him with his parents, you know there's a real connection there. That individual humanity, if that's the judge of outcome, it's a significantly positive one. But with parents, Being able to understand and have counseling support in that can be dramatic. Being able to do that when parents have access, off hours, not having to drive to the office, being able to do those anytime is a major support for increasing the amount of support and also helping them understand with a therapist what it's all about. This has a side benefit. If you think through, like some of the ABA therapies where they're intense, where we're correcting a behavior or enhancing a skill, and after that brief period we can see real progress, things have been done, but the real transfer of knowledge has to happen to the parents or to the school setting where this life is really going on. If you think of the follow-up with those skill sets and being able to use the family as those people that deliver it, being able to use telehealth makes that far more accessible and far more available. One of the things to keep in mind with that is that, let me give you an example. If we have a social interaction therapy that we have delivered, and we have a child that is dramatically showing improvement in the social interactions in our intense office setting. Imagine if we also, beyond that, that we can schedule a family night, a therapeutic family night with the family, where we have pre-designed activities that are going to foster and enhance the kind of therapeutic goals we've got. And the provider is showing up by telehealth to be able to observe, act as coach, and encourage how that is. That same setting can apply to all kinds of therapies. One of the issues mentioning at the beginning here was the number of different kinds of providers. Care coordination is a major issue. Having a supervisor being able to tie into a session, observe as coach, and see what the actual results are can be a dramatic improvement, can really enhance the delivery of care. Autism is one of those things that has a huge potential to be benefited by telehealth. That doesn't mean that every session needs to be telehealth, but it does mean that it is a whole new tool to be able to be added. When you think of this, think of the kind of things that ABA treatments do. They can be very, very intense for the patient, for the family, and for the therapist. And if those kind of modalities are being used, they can have the potential of significant outcomes. But one of the things that always needs to be considered is the supervision of that, where those techniques are being used by a variety of different people with different skill set goals, whether it's speech and language, whether it's the OT piece, or whether it's the psychological piece or the social skill setting. Being able to have the care coordinator, the one responsible for the overall care, be able to sit in these has a side benefit of constantly being able to look at the humanity of the patient. With all of these sorts of things, we need to keep that in mind first and foremost, that these are real little human beings, sometimes big human beings, that our goal is to increase and enhance their lives. But telehealth has an ability to be effectively used in a number of ways to reduce costs, extend treatment, and extend the reach of the therapist above and beyond just the offices. If you have need of further information, more tips, and more ways that individual therapies can be used using telehealth, please look for the other videos that address those items that you're interested in.